I am Dr. Mohammad Irfan Bande. I'm a consultant orthopedics at Artemis Hospital, Gurugram. So today we are going to speak about some problems in the shoulder joint. And when we talk about the elderly population, so the commonest thing we encounter in a shoulder is a frozen shoulder. Not every stiff shoulder is a frozen shoulder. There are other entities also, but today I'm going to talk about another set of pathology called the rotator cuff tears. So the rotator cuff is a complex of muscles which surrounds the shoulder. It gives stability to the shoulder in the elderly, and also it helps in movements of the shoulders. Various different kinds of elevations and rotations are managed by the rotator cuff. So the rotator cuff muscles are: the anterior muscle is the subscapularis, and then the superior supraspinatus, and then posterior superior infraspinatus, and teres minor posterior and inferior. So these are the muscles which are called the rotator cuff tendons, which help in mobility of the shoulder. So the rotator cuff tear is a very common entity happening in the elderly population. So most of these tears, they are neglected by the elderly population because there is pain in the shoulder, there is night pains, patient can't sleep, but still they can lift their shoulder a bit. So the fallacy is that there is a rotator cuff tear, but the patient is lifting compensatorily, and they go to the doctor very late. So this is one problem which happens in rotator cuff tears, and the patient seek medical attention when the tear is already progressed a lot. So what we do in rotator cuff tears is that we examine the patient, we get an MRI done, we diagnose the problem, and then we fix it. So there are various methods of fixation, and the best being the arthroscopic fixation of the rotator cuff, which we do routinely at our center. There are good results of rotator cuff fixation, rotator cuff surgery arthroscopically, and moreover, it's a keyhole surgery. There are no big incisions. You go through keyholes, you fix the rotator cuff, and the patient is out of pain, and they return to their function within 2 to 3 months post surgery. Thank you.